Newsnight exposes the shocking treatment being meted out to severely brain-injured patients by supposed specialist staff in dedicated units.
Grant, the staff are coming in. They will come in. You have been told repeatedly the staff are coming to wash you. We have to have handover first.
The NHS trust involved accept it was appalling. I'll be talking to a former patient who's been through the system, and with her, the woman playing a key role in sorting the problem out. Rare pictures of the inside of Guantanamo Bay detention camp have been broadcast on US television.
Please, Colonel, act with us like a human being, not like slaves.
That is the voice of Shaka Amar, a UK resident. His lawyer, Clive Stafford Smith, is here with his reaction. And Sir Nicholas Sirota treats Newsnight to the first guided tour of Tate Britain transformed. Good evening. When someone suffers a severe brain injury, their chances of recovery often rest upon the quality of the programme of rehabilitation they receive. Sometimes relatives find it very difficult to gauge the quality of that care. But what is indisputable is that expertise and care for brain-injured patients is uneven across England. Alison Holt tells the story of one woman's desperate measures to reveal her husband's shocking treatment at the hands of so-called rehabilitation specialists.
Every 90 seconds, someone in the UK suffers a brain injury. It may be from a bleed to the brain, a fall, an assault, often from a road accident. In seconds, their life and the lives of their families are changed. That's what happened to Grant Clark. He was 43 when he had a massive brain hemorrhage.
He dropped the children off at school, and then he was arranging to go motocross the following day. He'd gone over to where motorbikes were stored and just collapsed.
Grant was left severely physically disabled. Mentally he was fine, but he couldn't really speak. 18 months on, he's still not home, and his partner Binny feels he was let down by poor care at his first specialist rehab unit.
I was told he would be there for 3 to 4 months, and I thought rehabilitation was exactly that, rehabilitation to get you home.
After injury, the brain has to effectively build new pathways so that the person can regain the ability to do things. That can take weeks, months, even years. And it shows why it is so important to have good care and rehabilitation.
That process of helping Grant relearn skills was meant to happen here at the West Kent Neuro Rehabilitation Unit. Not long after he arrived in August last year, Binny started to worry.
He didn't have his teeth brushed, he didn't have his armpits washed, he was left in urine all the time. Every time I went to see him, he was wet to his armpits, cold.
She felt her complaints were ignored, so decided to take an extreme step.
He was crying unconsolably, and I said to him, would it make you feel better if I got a camera for your room? And he stopped crying almost immediately and started to nod yes.
From the first day, the secret camera picked up care that shocked Binny.
I think I need something sharp and pointy.
This healthcare worker starts cleaning the top of the tube, which delivers food, fluid and medicine straight to Grant's stomach. Care's needed because of the risk of infection. She does use an antiseptic wipe, but also borrows a pen and uses that. And over 10 days, Grant's call bell, his means of getting help, is taken away 3 times for between 10 and 16 minutes. On this occasion, when he presses the bell, a healthcare worker notes he's wet with urine, but says he'll have to wait until staff changeover is finished. Still waiting 5 minutes later, he buzzes again. This time, a senior member of staff comes in and takes away the call bell.
Okay, I'm going to take this away while we give handover, and then we'll come in and get you washed and dressed, okay?
More than 10 minutes later, and with no call bell, Grant starts pressing a keypad to get attention. When the same woman returns, she's not pleased. By now, Grant has been sitting in his own urine for more than a quarter of an hour.
Here's your bell. Grant, the staff are coming in. They will come in. You have been told repeatedly the staff are coming to wash you. But you have to have, we have to have handover first.
But what Binny saw 2 nights running horrified her. Grant wasn't meant to have anything by mouth. Unable to swallow, choking could be life-threatening for him. The camera shows an experienced healthcare worker giving Grant drinks of water on 5 occasions. Here Grant starts to cough. The worker whispers to him to keep it quiet. Binny was really worried, and overall Grant was making no progress.
He had to get out of there. I knew that he wouldn't come home. I told them that he wouldn't come home if he stays here and you keep treating him like this. He's not going to make it home.
Questioned by police, the healthcare worker said he regretted giving the drinks and now realised his poor judgment had endangered Grant. No charges were brought. The West Kent unit said it specialised in neuro-rehabilitation, but shockingly, an investigation by the NHS Trust found only 1 of the nursing staff had any specialist training in brain injuries. The Trust upheld most of the 26 complaints the family made about the care Grant received in the 4 months he was here last year, and he was moved to a place of safety. In a statement, the Trust says, "We remain appalled at what happened." It continues, "We subsequently created a robust action plan to address all concerns, which has seen sweeping changes. And there is now compulsory specialist training for all staff."
I think the attitude of the staff is very important as well.
Professor Michael Barnes has specialised in neurological rehabilitation medicine for more than 2 decades. He says it's difficult finding people with the right training for this specialist field, but it's vital.
You can't do good quality rehabilitation without good quality people. It's not about equipment, it's not about fancy scans, it's not about fancy equipment at all. It's about the quality of the person that provides the hands-on assistance.
And he believes services for people with acquired brain injuries are too hit and miss.
There are some very good rehabilitation centres in this country, but equally I'm afraid there are units around the country that really don't provide proper coordinated rehabilitation at all, yet that's what they're called, and that I think is a sad reflection, and something needs to be done about that.
And it's people like Shamel Courtney and her husband Mark who have experienced what a lack of specialist care can mean in practice time and again. In March 2007, Mark had a major asthma attack. It left him severely brain damaged.
He now needs 24-hour care, round the clock, 1-to-1. He's totally dependent on all his needs, nutritional, manual handling, washing, dressing, absolutely everything.
So long after the brain injury, her concerns now are less about Mark's rehabilitation, more about the failings in basic care that have meant she's actually been asked to train staff herself.
He's been in 4 different placements in the past 6.5 years, and I have not found that any placement is ideal. They all have their serious risks to these patients, that if I wasn't there, then, you know, I don't think he would be here either.
I'll just assist you with this one. Yeah.
For Grant Clark, being in a new unit that is providing good care and the rehabilitation he needs seems to be making a real difference. At the last place, he was told his future was in a nursing home.
Try to pump a bit more harder, please.
Thanks to the progress he's made here, he's now starting to spend time back home with his family.
There's good evidence that although rehabilitation costs more money, clearly, than someone going home or going to a nursing home, that money is recouped over 2 to 3 years by that person requiring less support from the state, getting back to work, and therefore earning money. So the short-term investment in further rehabilitation for 6 months or a year will be recouped by the state over 2 to 3 years.
There you go.
Grant is now starting to speak more, and he has clear goals. What is it you want to achieve? To walk. And what about going home? How important is that to you? The fight to get the right help has added to the trauma they faced. They find that hard to understand.
Alison Holt, well, we asked NHS England to come on to Newsnight tonight to discuss care provision for patients with brain injuries. Nobody was available. But Dr. John Etherington, National Clinical Director for Rehabilitation and Recovering in the Community at NHS England, gave us the following statement. NHS England is working to improve rehabilitation services, including specialist rehabilitation services for people with complex needs, such as those following a head injury. These include the establishment of a clinical reference group to examine the commissioning of specialised rehabilitation services, the development of regional trauma networks to review services, which has already led to service improvements, and a review of funding for long-term conditions is also underway. This work is vital to improving outcomes for patients. Well, here tonight we do have Kate Allatt, who survived locked-in syndrome and knows just how vital good rehab treatment can be, and Professor Lynn Turner-Stokes, a rehab specialist who was asked by NHS England to lead the push to devise new guidelines for the rehab treatment of brain injury patients. Good evening to both of you. Professor Turner-Stokes, what do you make of Grant Clark's story?
Well, it's difficult to comment on individual cases, of course, but really that doesn't look at all of the sort of standard that one would expect to have. And I think the point about that is that it really underlines the necessity to have patients who have complex disabilities cared for by staff who have the
staff that was specialist treated in that. I mean, that is quite extraordinary, isn't it? It calls itself a specialist unit and had one trained specialist?
And the British Society of Rehabilitation Medicine has set out some standards for what we would expect in the way of qualified staff to be on their specialist units, and the normal recommendation is at least a third of the staff to have specialised nursing staff to have specialised training.
Kate, before I talk about what happened to you with your locked-in syndrome, I know that you now campaign on behalf of relatives and families. Presumably Grant Clark and indeed Mark's cases are not isolated.
They're not isolated. There are a lot of people I deal with who have great experiences in rehab if they get the opportunity to go to rehab, which isn't always the case. So I have to say that there are some good examples. Mine was very good, but this was appalling. I mean, appalling. I mean, my heart goes out. But how often do we see vulnerable people in society being neglected like that across all sectors?
And for you, what happened to you?
Well, I had a brainstem stroke with locked-in syndrome in February 2010, and basically that left me unable to do anything to communicate through blinking. That was it. Nothing else moved. I felt everything, but I could move nothing.
And the process of getting better, is it about a partnership? I mean, the way that nurse was talking to Grant like a child.
Yeah, well, again, I think that's appalling, and I think that's very patronising, and I think that's very controlling. I think that the key thing in rehabilitation units, there should be specialised neuro-OTs, speech therapists, neuropsychologists, there should be neurophysiotherapists, and I think especially neuropsychologists, because I think as part of a rehabilitation programme, you need to have the loved ones on board, you need to have the
because they're terrified too, presumably, because you were unable to communicate, so they wouldn't really know if you were receiving proper care or not.
Exactly, and also you have to also factor in the fact that loved ones a lot of loved ones tend to believe the doctor in the white coat because they don't know any different.
So part of the problem is that you can't be guaranteed, as we said, and in fact, what did Professor Michael Baines said? He said there are units that don't provide proper coordinated rehabilitation at all, that it is another form of postcode lottery.
Well, indeed, and I think it's fair to say that up until now, rehabilitation has been something of a Cinderella specialty. Much of the focus has been on acute and frontline services, and specialised rehabilitation just really hasn't had the level of prioritisation that we would really need to see.
Is that because, as Professor Baines was saying, that the initial injection of cash is quite high for rehabilitation, but it's down the line that the savings are made, and the trusts look and go, we can't afford this?
Yes, that's so. It does look expensive to start off with, but when you see those advantages play out over the life of the patient, and we're often looking, as indeed in this film, and quite young patients who've got the rest of their lives to
isn't that
really
the problem with the budgets of hospitals? I mean, you know, they would like perhaps to think about the outcome 3 or 4 years down the road, but what they're concerned about is their budget over the next 12 months.
Absolutely, and that's partly the way that the system is funded at the moment, going from year to year.
And would you suggest it shouldn't be funded like that?
No, I think one would like to see longer term planning and strategy, really trying to make sure that we take advantage. We have, as Mike Barnes said, really good evidence that rehabilitation can be cost effective, and what we need to make sure is we do reap those benefits. Oh,
you're on just the question of your rehabilitation. How did that play out? Were you with the same staff? Did you have continuity of care?
Well, I was in ICU for 9 weeks and then went to Osborne 4 straight there, actually, which was a bit of a shock. But they were an amazing team, they really were. But they had a very driven patient. And I think motivation of the loved ones, motivation of the patient, and the team, who identified with a young mother with 3 kids at home, you know, it was easy for them to do something for me because they could see my plight and feel my plight. And yes, they got out of me as much as I got out of them, because it was two-way and I worked hard. And I think that's important. I think also rehabilitation, I have to say that I think the rehabilitation should start a lot earlier than it does in this country. It should start in ICU like it does in Denmark, 2 days after the coma.
Thank you both very much indeed. In a moment, rare access to the inside of Guantanamo Bay detention camp.